Diagnosing bipolar disorder can be very difficult because, as you may have noticed in the previous lesson, there are a lot of symptoms that overlap with a lot of other disorders. And so it is often very common to have comorbid disorders or disorders that are diagnosed simultaneously and within the same person. And these are the ones that are most commonly diagnosed with bipolar disorder. And when we get to borderline personality disorder, it is somewhat often diagnosed with bipolar disorder, but is also often confused with bipolar disorder. So we'll talk about the main differences. Let's talk about generalized anxiety disorder, or GAD. So, generalized anxiety disorder is the excessive anxiety and worry, like apprehensive expectation, that occurs more days than not for at least 6 months about a number of events or activities, and it has to involve three or more of the following: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. So, as you can see, irritability and sleep disturbances, as well as difficulty concentrating, are also key symptoms in bipolar disorder. So, often they look for additional ones like being easily fatigued, and muscle tension as well. Let's talk a little bit about attention deficit hyperactivity disorder. So this is ADHD, and there is 2 slides for this. So just keep that in mind as we're going through this. This is persistent pattern of inactivity and or hyperactivity impulsivity that interferes with functioning or development. So in DSM-5, they kind of split it up so that it's more of a spectrum of ADHD, where you can be inattentive ADHD, or you can be hyperactivity ADHD, or you can be both. So this includes at least 6 or more of either inattention or hyperactivity impulsivity. So some of the symptoms of inattention are things like fails to give close attention to details or makes careless mistakes, trouble holding attention, doesn't seem to listen, doesn't follow through on instructions, trouble organizing tasks, avoids or is reluctant to do tasks that require mental effort, often loses things necessary for tasks and activities, easily distracted, and forgetful. Hyperactivity, on the other hand, is 6 or more, fidgets or taps with hands and feet, or squirms in seat, leaves seat when remaining seated is expected, runs about or climbs in situations where it's not appropriate. This can look like restlessness in adulthood. Unable to play or take part in leisure activities quietly, often on the go as if driven by a motor, blurts out an answer before question has been completed, trouble waiting their turn, interrupts or intrudes on others. So a lot of these impulsivity and hyperactivity symptoms can be present in manic or hypomanic disorders, but not necessarily present in depressive symptoms or depressive episodes. And so it's important to look at the individual as a whole to determine, do they fit both diagnoses, or does one explain their behaviors and thought patterns better than the other? Borderline personality disorder has 3 kind of key categories, and each one you have to meet a different number of symptoms. So as far as personality functioning impairments, you have to have at least 2 or more. This is an unstable self-image, unstable goals and values, compromised ability to recognize feelings and needs, especially in others, intense, unstable, and conflicted close relationships. So some of these might occur with bipolar disorder as well, like an unstable self-image, when we're thinking about the mood swings. As far as personality traits, a person with borderline personality disorder or BPD needs to have emotional lability, anxiousness, separation insecurities, depressivity, impulsivity, risk taking, and hostility. Again, some of these you'll see with depressive episodes, and some of them you'll see with manic episodes. Persistent patterns of behavior, they need to have 5 or more. So, desperate efforts to avoid abandonment. This might look like strained relationships of begging their significant other or family members not to leave them, especially when things start to become unstable. Unstable and intense relationships, unstable self image. Again, that's also shown in the personality functioning impairments. Impulsivity in at least 2 areas that could harm themselves. So, this could be like shopping sprees, or it could be inappropriate sexual behavior. Also, repeated suicidal behaviors and or gestures. So, this might be threats of self-harm or threats of suicide, or the actual behavioral behaviors of suicidal behaviors. The main difference, and I put these in stars because borderline personality disorder, the changes in mood are very rapid. With bipolar disorder, it's a lot slower, where the mood changes last several days to several weeks to several months, whereas with borderline personality disorder, they can change within hours. Persistent feelings of emptiness, inappropriately intense anger, and temporary paranoid thoughts. So here is a little graphic kind of separating the two. So borderline personality disorder, it's marked by severe emotional dysregulation, whereas mood disorders are the mood disorder of bipolar disorder is characterized by depressive and manic states. So with borderline, mood swings last from hours to maybe days, whereas with mania and depression, they can last several days to several weeks to several months. BPD usually occurs because of early trauma and the brain chemistry that's associated with it, whereas bipolar disorder is typically more genetic and chemical imbalances. Treatments do often look the same. It's usually psychotherapy and medications for both, but the type of therapy is usually different for the two.